Hi, good morning, everyone. Alexandra here with MDPen. I'm the brand product specialist. Today, I have a very special guest, Terri Grier from the Skincare Studio of Connecticut. So happy she can be here. We already have 14 viewers. Wow, 16. This is great. Thank you guys for taking time out of your morning to be here. We have a topic that is very much, wanted. And it's great that we're doing this right before summer. We're going to be talking about treating hyperpigmentation in sensitive skin, in skin of color. There will be multiple giveaways throughout this video. So do please stay tuned throughout. You're very likely to possibly win something. We're going to be giving away MDPen's vitamin C and E brightening serum and our broad spectrum SPF 30 amazing sunscreen. This sunscreen is also packed with antioxidants, and our CE is amazing. I will talk about it more later. At any point in the chat, feel free to ask a comment if it pertains to the topic or exactly what we're talking about. There will also be time at the end of the video to do unfinished Q&A where we can hopefully get through your comments. So first thing we wanted to discuss is obviously the types of hyperpigmentation that we see the most in aesthetics. And Terri and I kind of put together like 4 different categories. So first we have like actual sun damage, so solar lentigines. Yeah. And we know how this can appear on the skin. Terri is a dermatology RN who you opened your own practice, Terri?
I did, yes. I am a nurse of 13 years and in derm for 11, and I opened up my own skin clinic really to cater to hyperpigmentation and acne. That's really our focus here.
That's awesome. And Terri was my first choice. I was so glad that she could do this with me. So when it comes to solar lentigines, these present as sun damage. And then, of course, we said hormonal pigmentation was another, melasma. Post-inflammatory hyperpigmentation we'll be talking about, and that can be secondary to trauma or acne. Anything you want to say about these categories? I know we're going to kind of go into them in more detail as we go.
So really the main reasons for hyperpigmentation. I think we definitely hit it on the nail there.
So viewers, I'm going to ask you guys, this is for our first giveaway. What type of hyperpigmentation do you see the most of in your practice, in your office, in your spa? You can be a doctor to answer this, an esthetician, a nurse. We don't care. We all see it. Do you see sun damage? Do you see melasma? Do you see post-inflammatory hyperpigmentation? What do you see the most of? Please use the comment box, whichever social platform you are using, and we will do a giveaway with someone that answers. So thank you guys so much. Oh, we've got a YouTube viewer. Hey, Deborah. Deborah sees melasma. Awesome. And Deborah is with MDPen. She is one of our professionals. So thank you so much, Deborah, for sharing your information. I actually have your contact, so I'll be in touch with you to make sure that you do get a CNE and an SPF. So thank you for participating. So who do you find to be the most prone to hyperpigmentation, Terri?
To be honest, I would say the most that I see is definitely Asian, Hispanic, I would say African American, Caribbean, and Italian. I see a lot of that come in for hyperpigmentation specifically.
Yeah, I totally agree. And that's something I didn't see until I'd been working. I think I started in derm in 2009. And, the further I got in, I understood that there could be light-skinned, Hispanic women with green eyes that were more fair than I am that were getting melasma and hyperpigmentation. So it's such just a large, broad group that you see there. And that's why we included sensitive skin into these categories, because a lot of times the types that she answered do have, sensitive skin. And as a general rule, we call skin of color usually Fitzpatrick 4 to 6.
Absolutely.
But it's not always a rule, correct?
No, no, because you have to be really careful, because so many of us, because of our background, can be really any Fitzpatrick. You really have to do your due diligence and find out exactly who you're talking to. Just because someone is lighter skin complexion, you still have to make sure that they may not have a Hispanic background or a very, Italian background or whatever it may be, because they're prone to hyperpigmentation.
Yeah, I completely agree. Why do you find that it's not always best to go straight to laser or peels? Because this has always been kind of the go-to, and it's very misunderstood. How do
Well,
you distinguish?
I here in my practice, I'm very big on consultations. A lot of people call and they want to come in for a peel straight off the bat. If I've never seen you, there's no way that I can do a peel on you. So that's a rule of thumb in my practice here. But to answer your question, when it comes to when is a peel is not for everybody. Some people really, their skin is compromised or they can't handle a peel. Um, and so you kind of have to I do a consultation to kind of do a skin analysis on them. I do a couple little tests with different chemicals to see if they're able to appropriately take in a peel. Because I think everybody thinks that a peel is really the end all be all, but there's so many different things to do besides a peel.
Yeah, I completely agree. And even though some peels can be used on skin types, all Fitzpatrick skin types, sometimes just for the integrity of the skin or healing purposes, it's sounding like you still don't necessarily go to those peels.
Not all the time, though.
Um, One thing I've noticed too, obviously with like IPL and photofacials, there's other, and here I can, drop some names or you can drop some names of certain laser devices. But there's certain laser devices on the market
Yeah.
that can be used. Do you ever, I know you do a ton of microneedling, and this video obviously isn't to be boastful about MDPen, even though we have an amazing device, you can go outside of it
Right.
in instances that you need to find, other treatments. So I know
Absolutely.
there's things like the halo laser
Right.
indicated for melasma. And when would you distinguish to use this or not to use it, or how to space it from microneedling?
Right. Well, the halo, just because we were talking about the halo laser, things like that, I'm very wary about on darker Fitzpatricks. For certain Fitzpatricks, it's perfectly fine to use a halo or any kind of laser, including IPL and things like that. But specifically, hyperpigmentation is so. Um, it's really, you got to really know the person that you're working with, because you can end up doing more harm than good if you don't know your client well. So in my practice, I'm just a little more particular about when I kind of uh, suggest certain things like that.
Absolutely. And it's pricey. That's where microneedling also becomes a great price point for people too, if they don't want to pay for these, certain lasers. But you can definitely damage skin that is sensitive, and that's why sometimes it's great to start out, with microneedling or something like this, um,
Absolutely.
or alternate it. I think in your practice you have, is it PCA peels?
I do. I do have PCA pills here, which I love. But microneedling is a really great option for my office and a lot of offices that see different skin types. Only because like we mentioned before, peels are not for everybody. Sometimes their skin truly has to be built up to that point. Lasers are not for everybody. And what I've found with microneedling, it tends to really be that happy medium for a lot of people who have severe hyperpigmentation.
Absolutely. So when you do bring this client in and you consult with them, um, do you usually, as far as procedures, devices, you go straight to microneedling as your go-to?
Not necessarily. The thing is that I I wouldn't say that's really my go-to. It is it's a good option for a lot of people with hyperpigmentation, but I would say trust your analysis with your client. Really get to know their skin before you jump them into a treatment. Do some sort of I always do like a mini facial prior to even treating a client, just so that I know which way we can really go. Um, I'm very conservative here when it comes to that, just because I know how sensitive the client is and how serious the hyperpigmentation can be. But for me, microneedling is a very good happy medium. It can be the first treatment, but it's not always the first treatment here. I may do something else, and I may start off with a peel. I may start off with something else before I jump into microneedling. But there are clients where the microneedling is their first treatment. But you really have to really know what kind of skin you're dealing with before you do that.
Yeah, thank you for saying that, because I say it all the time. I don't think I can say it enough, especially those of you that have device facials that you're paying a lot of money for. Every person who walks through your door, especially new patients, that should be your go-to treatment. As much as we want them to become an MDPen microneedling treatment, it is so good to do that initial facial, that initial consult. You're going to help with exfoliation. You're going to decrease their risk of purging. So like Terri said, don't be afraid, even though it's, just a facial. It's not just a facial, and it really does help prep the skin
Exactly.
prior. Absolutely.
It does, and it kind of helps them get familiar with you and you get familiar with them, because skin is so different, and I've seen it react in so many different ways. And although microneedling is a wonderful treatment for hyperpigmentation, I just, first time seeing you, I cannot, just start microneedling you. It's such a, it's such a particular treatment. And so I think as providers, we really have to, pump the brakes on that one, and trust our judgment when doing so.
I'm going to show a question now on the screen, and this question comes up a lot, probably from other people into the industry that are learning.
Yes.
This LinkedIn user is asking, can you do microneedling and a chemical peel at the same time?
Well, I know that a lot of people are incorporating peels with their microneedling, and I've seen some people really do that. I personally have not done that, because I would rather allow the skin to recover properly and then do a peel if I feel that's what the direction that we're going. But I have never really done it combined, because I like to make sure that the skin is properly treated each time. And that's just my personal way of practicing. But I have seen people do them together depending on the system that you're using.
Oh, yeah.
Yeah.
Yeah, I agree. I don't do it. You can with certain peels. You really have to go at the discretion too. I'm obviously a esthetician, so it was always based on the discretion of my physician. Another thing too is when you add the peel, even if it's a micro peel, even if it's a 6% TCA, it becomes 2 treatments.
Right.
So your patient that may have only wanted to be blotchy or peeling for 3 or 4 days isn't going to get their wish anymore.
Right.
So sometimes it's better,
yeah.
Maybe have them come back anyway in 2 weeks for a manual exfoliation or a dermaplane, and do the micro peel then if you want to, or the sensitive skin peel. That's another way to go about it, but it does become, multiple treatments when you do add a peel. And speaking of peels, one thing I wanted to throw out there too is, even if a peel sounds like it's, for sensitive skin, like, oh, I've got this fruit enzyme, peel, some of the nastiest reactions I've ever seen. I don't know about you.
Oh my gosh. The nastiest reactions have been from these natural, enzyme, fruity kind of things. And I always tell everybody, just because it's natural doesn't mean it's good. Natural doesn't always mean better, or, it could be more damaging, actually.
Yeah, one of the nastiest reactions, I was in school at the time, and someone just walked in from off the street into our classroom, and she had had some type of fruit acid-based Jesner peel, and I was shocked, absolutely shocked. Let me display some more questions on here. Oh, someone said they got burned a few months ago from the chemical peel. I'm so sorry, Marie. Oh my goodness.
Yeah, that's the worst. It's the worst. I have had numerous clients come in, burned from someone else, and it's awful. It's truly awful.
It is. So MDPen microneedling is actually asking you if you can exfoliate with hyperpigmentation, or is that something that you recommend?
Can you exfoliate with hyperpigmentation?
I guess they're meaning if the patient or client or themselves should be exfoliating at home.
It depends. There are some clients who do have hyperpigmentation, but they may not need that manual exfoliation constantly. Their skin may not be able to handle that. So then I would say, let's kind of cool off on the exfoliation. We're doing enough of it here. But then we do have some clients that do have hyperpigmentation, but then they have really oily spots and clogged pores. Okay, so let's do a manual exfoliation at home once a week or twice a week to help really purge out the skin properly. So it really depends on the client. Everybody's so different.
As a general rule, what treatment depth are you usually at when you're microneedling hyperpigmentation?
Well, it depends. I know I keep saying this, but it really depends on the person. And, I like to see, really, it depends. If their skin can handle it, certain parts of the face, we start at different depths, so it's hard to really generalize, I guess, the treatment.
So I'll throw something at you. Let's say they're a melasma client and they have a skin type 5 on the Fitzpatrick.
Yep.
So in this case, myself, I consider that where I should be more, a 0.5 depth, maybe max.
Yeah.
And my MDPen speed might be at medium high, because I know that a lot of what I'm treating right now is just superficial, what the eye can see. But then I know that there's also pigment, at the dermal layer. Whereas, if someone comes in with PIH, and I know you and I talked about this, people with acne will call an office and say, I need microneedling for my acne scarring. It's really bad. And it's always a huge relief when that person walks through the door and you see that it's actually PIH. So would you microneedle this person, possibly different from that melasma client?
Well, yeah, of course. Yeah. Just like I would treat someone differently who has severe scarring, whether it's ice pick scarring or whatever the case may be. I'm going to treat them differently than I would treat the hyperpigmentation and melasma, in terms of depth and speed. So it really depends on, who's walking through the door, what the concerns are, how deep the damage is, and then we sort of adjust the treatment based off of that.
Yeah, absolutely. And that's why training is such an important part of microneedling. And it takes years for you to see, every type of skin that you might microneedle, every condition, and everyone's always learning. So I think that's one great thing about MDPen is with our training, education. I'm going to put up a skincare question right now. Does retinol help with melasma, and what is the aftercare for treating hyperpigmentation with microneedling?
So retinol is fantastic for all types of pigment concerns, including melasma. So that is true, but I would definitely, be very careful with how you introduce your retinol to your client, because we don't want to then cause other issues. But in terms of aftercare for the hyperpigmentation, I am very particular about how I, send my clients home. I send them home with a very gentle cleanser, like a recovery toner type, and a super hydrating moisturizer, because I know that their skin's going to go through multiple stages of healing. But the big key factor that I always send my clients home with is growth factor. And the reason why is because growth factor is going to give you that rapid healing, as well as, your client wants to see the results of the microneedling. The growth factor pairs with that so well. So, micro growth factor is probably one of the things I absolutely send them home with. There is no option. And before we talk about them going into microneedling, this is discussed in detail, because if you want to be microneedled here, we have to make sure we do it correctly. And I want you to always have your optimal result, even after your first treatment, your second treatment, whatever treatment it will be. We definitely make sure that we pair it with proper things.
Yeah, I was really glad when you told me how much you love growth factors and how you recommend them for so many patients, because I think it can be forgotten when it comes to everyday skincare regimens.
Yeah.
A lot of times when people think of it, they just think about skin that is, aging or mature skin, when really the growth factor has so many benefits.
Yeah.
And if with MDPen, we have, our professional size for our growth factor, we have this 3.4-ounce size, and we now have it in a 1-ounce size. You can also include in your treatment so that your patient can go home with a growth factor. If you want more information on ours, you can definitely visit our website. I'll be putting up a shopping code at the end of the video for all these products that are mentioned. Again, I agree with you. A gentle cleanser, MDPen's hydrating cleanser, HA copper mist, is something they can mist with or use every couple of hours, especially that first day. And something very hydrating as well to treat the skin. So it is a commitment, and someone can't go into microneedling without knowing they're going to be having to buy skincare.
Exactly. Yeah.
Let's see, I've got another question here, and this is kind of where I was going. How many sessions, Terri, are needed to see results for hyperpigmentation sun damage?
To be honest, after your first treatment, your client should see results. They really should. And if they're not, then you have to reevaluate your treatment plan, and, kind of adjust, because, going back to growth factor, I actually use growth factor as my glide a lot of the time. I mix it in with HA, or I mix it in with whatever I feel like doing, whatever the client needs, but growth factor is always in that mix. So, it kind of accelerates the treatment. So after the first treatment, most clients should see some result, not ideal result, but definitely results.
Completely agree. And that's where, having a good pen comes into play. Being able to promise results like that is a huge deal.
Mm-hmm.
And you don't want to do that unless you know yourself as a professional, you're going to be able to perform well with the pen that you're using and the motor on it, how you're treating the skin. Within 2 weeks, they should look like they've pretty much had some type of brightening peel. Like the skin, people always say my skin looks softer, looks brighter. These are the types of, more instant results that you can see with MDPen. And then I like to say by the time you're coming for your second treatment, you should see some type of collagen growth, whether it's your pore size, maybe a couple fine lines, something like this. But I love that you said that, and the products come into play. The professional, who's doing the treatment, the device that they're using. There's so many things at hand when it comes to being able, to promise something like that.
Absolutely. The pens, I've used almost every pen. I've been doing this a long time. I've used a lot of pens, but your pen truly matters, because if you use a pen that is, the motor's not good, you're going to get snagging. You're going to create scarring. If you use something that's not getting deep enough, um, all of those things, it really plays a part. And your pen is a part of your treatment. Yes, your eyes and your technique is everything as well, but your pen matters a lot, a lot. So to be able to say, you know what, yeah, we're doing microneedling. Yes, this is your first time, but you will see results in 3 to 4 weeks without a doubt. That's a huge thing to be able to say, guaranteed.
Completely agree. For suppressing pigment, what are some of like your go-to choices? Because we know that we also need to do that with these, different types of hyperpigmentation.
Yeah. For me, I love hydroquinone-free pigment gel. The reason why I'm not a huge fan of hydroquinone is because we know that it can damage the skin, thin out the skin very quickly, dry out the skin, and that can cause barrier issues down the line. So I really do like a hydroquinone-free option when it comes to suppressing pigment.
Absolutely. And those do exist.
Yes.
For people in the comments that are asking about, HQ, a lot of times too, as we know, the HQ is teamed up with that high strength tretinoin gel or tret cream. And then you've got, your mild cortisone or steroid grouped in there too. So for those of you that haven't used one, that's really what Terri's talking about. It can be a constant irritation, a constant flaking. Often you have to take a break from it, after 8 weeks, 12 weeks, whatever your physician's telling you. And then it's a matter of building back up the barrier again. So even though you may get, this great result, sometimes it's not long term. So a safe choice like an HQ free serum or, a high potency vitamin C, which we'll get into as the next category, can be much better choices. And I love antioxidants. I feel like everyone needs to be on one, whether you have no hyperpigmentation or a ton of hyperpigmentation. Why does your vitamin C make a difference? Like the type that you're using, because not all vitamin C's are obviously the same.
Well, you definitely want a high potency, high quality vitamin C because that's just going to penetrate better. If you get something that's not of high quality, I guess, it's not going to penetrate your skin properly and it's not going to truly do what an antioxidant is supposed to do. And that's the whole point of purchasing the skincare, is because you want to protect your skin. You want to see your skin go through changes that it's supposed to go through when you buy a vitamin C. So it's important to make sure that it's a high potency.
Absolutely. And at MDPen, for those of you that are looking for a vitamin C or already use ours, just as a reminder, our CE brightening serum is 2 types of vitamin C. It's 21%. It has vitamin E in it, green tea, licorice. These are things that can not replace a hydroquinone, but really help out with darkening. It also has Nutrizen in here. We wanted to create a vitamin C that patients with rosacea, sensitive skin, can use. I'll go ahead and put it up now, but for those of you that are looking to go shopping today, during this video, after this video, I've got a code there, top left for you guys, SkinPen. You'll save 10% on our website, which is there in the comments if you do choose to buy, any of these products, our SPF, our vitamin C, our growth factor, all have been mentioned, in this video. So absolutely feel free to go shopping there. Getting back to Terri, can you share with me, I know you have a few success stories of treating hyperpigmentation that you've seen.
Yeah, there's actually one in particular that always stands out to me because she came in for a consult. She was really unsure of me. She was just mad because she's been through so many places and has really gotten nowhere. She had extreme PIH. I mean, it was severe. She even had some, acne here and there that we wanted to clear up as well. I did a peel on her. I started her off with a peel, and then we quickly moved into microneedling. And her second session was microneedling. And after I saw her from her peel to her microneedling, saw her again, she was blown away. And she was blown away because she started to see change. And she has gone through countless, I can say at least 4 people, and no relief. And this woman was coming from Queens. So she was driving in from Queens, New York to Connecticut. And she would come in every 4 weeks. So we I did a rotating regimen. And I sent her home with proper skincare, all of that. She stayed so committed. And literally after, I would say, about 3.5 months, significant difference. I mean, she went from deep scarring to improved texture. Her color was transformed. And, she stood out to me because when she came in, she was so defeated. And after quite a few months, I mean, for her to come in, she lit up. She's waving to everybody, all the staff. And you just see a change in not only her confidence, but who she was. It's like the damage from her skin was sort of depressing her personality. And that success story, among others, have always struck a chord with me. But, just to see someone light up just from change in their skin just means everything. And hers in particular, because she drove so far. She worked overnights. She would come in off a shift. I mean, it was tough, but that one meant a lot.
Thank you for sharing that. So yeah, it definitely was worth it with the drive.
Yeah,
it's a big drive.
No, it's funny. We would make her tea. We would do everything we can to just cater to her because we knew that this was a drive. She was coming off a 12-hour shift, and she's a former nurse. So she gets it. She understood my practice. She understood what we were doing. And just to see the transformation, it was awesome.
This is a question from Christy on Facebook. And I want to reiterate this for her and anyone else who's asking the same question. So yes, pure HA can be the go-to glide for pretty much any microneedling treatment. What Terri had mentioned with using a growth factor product, yes, you can use our human-derived growth factor gel as your glide. You will want to use some HA since it is a gel, and the HA is going to help balance out the thickness of our growth factor gel. You don't want to risk clogging your needle cartridge, but that is how you're able to use the growth factor gel as a glide while needling. We also have products called Tighten and Lift and Cellular Renewal that are 2 serums from MDPen that you can also use as a glide while needling. They both have different purposes. In the case of Tighten and Lift, it does have a little bit of lactic acid and green tea in it, which can be great to use for those hyperpigmentation treatments. So that's one great thing about MDPen. We have so many different glide choices, and you can create, your own concoctions. You don't just have to use HA. And I'm sure Terri agrees. You want to stay away from vitamin C while microneedling.
No
microneedling.
No. Yeah, vitamin C is like, don't do it. But the Tighten and Lift is wonderful. I love to use that as well. And the growth factor. I mean, the MD growth factor is fantastic, but depending on what you're dealing with, the Tighten and Lift is wonderful too.
The story that you told, Terri, Deborah's asking what her Fitzpatrick was. Like, what was her number?
She was actually a 5.
Okay. Very good. Again, guys, there's shopping codes. I know there's so many questions out there right now in the comments. I want to get to some more. We have someone asking a question about sunscreen and applying it after treatment, which we don't do. So basically the question that you're asking is something, we don't apply sunscreen immediately following microneedling. At MDPen, we believe in resuming sunscreen the following day. Yeah. So Terri agrees with that one. Let's see. We've got another IPL question here. I'll just kind of put this up here. So for those of you that don't know, IPL is synonymous with photofacial. So it is a type of laser. We talked about, this isn't for everyone, especially with skin of color, sensitive skin. Do you have anything you want to add?
I think IPL for hyperpigmentation is fantastic. But, like you said, Alex, depending on the Fitzpatrick that you're dealing with, but the higher Fitzpatrick, the lower Fitzpatricks, absolutely. I think IPL is fantastic. I've seen amazing results with that.
Yeah, I completely agree. We would tell patients, I mean, sometimes you can get your skin, if you look at the inside of your forearm, I mean, after a couple IPLs, to get your skin to look like that skin is amazing, which you can do on, the lower Fitzpatrick numbers, myself included. I consider myself to be like a 3, sometimes a 2.5, I don't know. But IPL can be an absolute like home run treatment. Plus you're targeting, the redness and the erythema and all that, along with the hyperpigmentation. So thank you so much for asking that question there. I want to do a question that has happened during this video to see who's listening and who wants to win some more skincare. What skincare products were Terri's choices outside of hydroquinone for patients with hyperpigmentation, skin of color, sensitive skin? What products did she recommend or review? You only have to say one, and I will choose a winner again to win our broadband SPF 30 and our vitamin C serum from MDPen. So just answer right there in the comments. We got someone.
All right.
Awesome. Benina, if you can just message directly into Facebook, since that's your platform, please give us obviously your contact info, email, that way we can get your address and such to be able to send these products with you. Thank you guys so much for participating there. But she went straight for that HQ-free product. So awesome. You're quick on that. Anyone who has asked a question or commented during the time of this video, you will also be entered to possibly win this skincare, and we will find a way to get in touch with you as well. Anything you want to add that I did not say? I know we didn't really talk about sunscreen a lot in this video, which is obviously a must with hyperpigmentation and with anyone.
Sunscreen's major. That helps protect our skin from the sun and from getting even more hyperpigmentation. So sunscreen, along with other things that you can do, like the vitamin C or the HQ free, will only help your client with hyperpigmentation. It's one of those things, not only hyperpigmentation, but anti-aging, and the list goes on. So we know how important sunscreen is, of course.
Absolutely.
And above.
Yeah. And when you guys go, for those of you that aren't in the skincare industry or professionals, when you go to certain stores and buy sunscreen, it can be a chemical only based sunscreen. And these are things that you want to avoid, especially after a procedure. You have to have a physical block within your sunscreen. So that's where it becomes really important. This is a great question I want to share too, real quick. She's asking, how many days later do you guys have a patient apply makeup after microneedling?
I always say if it's mineral based, it can be the next day if you absolutely have to. But try to stay away from it for at least 3 days. I always say that, but I'm sure, some clients don't listen to that, but that's okay.
I say the same. And as far as when she says mineral makeup, I think there's a misunderstanding. There's really only a handful of true mineral makeups that exist.
That's so
in
true.
The US at least.
Yeah, very few.
very few. And when I worked in larger, plastic or dermatology offices, we had that makeup carried in the office. I'm sure you did too. And you could,
Yeah. So
color
I
match.
point them in the right direction. Yeah.
Absolutely. So in those instances, they can use it the next day. If it's something over the counter, if it's something with mineral oil, if it's something with talc, absolutely need to wait at least 3 days. I agree. Thank you. We had someone guess kojic acid. Although we didn't mention kojic acid, yes, it's a great alternative
Phenomenal.
to
Wonderful.
HQ. Thank you guys so much for being here, for participating. We really love doing this video. We would love to do more of them. If there's, a better time of day that works for you guys, we'd love to hear that too. But hopefully this did work out. I see someone asking a question about tretinoin. Yes, so with vitamin A, there's tretinoin, there's retin-A. Then we have, retinaldehydes, retinol, all in different categories. I think this might help the person who's asking this, but would you say that in certain instances they can use a prescription strength retin-A, or in what situations you would recommend that over using a retinol perhaps?
Right. That's a very good question, because I do have some clients who, if they have like acne issues that are active and things like that, then, absolutely you should be having something that's prescribed. Because, you know, it's going on, and we need to really make sure that we can suppress it properly. So there are times when a prescribed tretinoin is, recommended over a retinol that I may have a medical grade or something like that.
Awesome. And where can everyone watching this video find you? What is like your social media handle?
Yeah. So I have Skincare with Terri on Instagram. We also have the Skincare Studio CT on Instagram, as well as the Skincare Studio CT on Facebook. So, we're always there. You guys can find us on there. We do a lot of different videos and things like that, especially when it comes to microneedling, because it is one of those things that people are so interested in. I'm so happy people are interested in it because it's such a great treatment. So I try to do a lot of videos of me doing it so people can understand that it's nothing to be scared of. That it's something that we can walk you through, but it's a great treatment in terms of hyperpigmentation. So we have a lot of videos on there, as well as our Facebook as well. A lot of videos to kind of, not only for clients, but for SDs and nurses who are inspired and want to get into aesthetics. I really try to teach a lot of estheticians and fellow nurses that it's okay to dive into skincare. And I try to teach that as much as I can.
Thank you so much. I've highlighted Terri's website there too on the comments, so you guys can visit her website. All her social media handles are there. Again, her Instagram, you can see in the comments, skincare_with_Terri, and the Skincare Studio CT. You can also see there as well. So do check her out. I'm hoping we can arrange for more of these. Really have enjoyed this with you guys. Hopefully you'll be able to go shopping with that code if you are interested in any of those products we mentioned today from MDPen, if you're not already carrying them. And if you have suggestions about a topic you'd love to hear us talk more about, it seemed that hyperpigmentation really hit home and has been in high demand. So please let us know, guys.
Yes.
And again, thank you so much, Terri. Really appreciate you. I know you're always busy all day long with patients, and thank you so much for fitting this in for us.
Okay. Honestly, I really enjoy this. And like I said, I originally, wanted to do this really to let people know how great these treatments are, and not to be scared. Trust your training, trust yourself, trust your knowledge, and know that you can help people in a different way. Pills are wonderful, but microneedling is fantastic too.
Absolutely. And we'll be happy to train you if you do go with MDPen. We are here for you and your continued education, 100%.
Yes.
So thank you, everyone. This video will post up to all the platforms. You can go back and watch it as you'd like. So thanks, guys. Have a great day. Bye.